What is migraine, which in Urdu is also called dard shakika, or half-head pain? We've heard an example since childhood that Allah shouldn't make even an enemy a migraine patient or someone suffering from half-head. Today we'll understand its basics so that those who are affected by it can better understand the inclination of this disease and its progression. If they understand it, not only can they control it, but God willing, they will succeed in living a healthy and First of all, understand that there are two types of migraines. One type of migraine is what a person acquires at birth. This is genetically transmitted. It's also called hereditary syndrome, or what we call genetic syndrome. Migraine inherited from parents will affect at least one or two children, regardless of how many there are. We call this stagnant. For example, if a migraine patient has 5 children, whether the parent is mother or father, if they have 5 children, regardless of how many boys or girls, one child will definitely develop migraine. This is called inherited migraine. These are called migraine due to inheritance. Then there's a migraine that occurs in life when a person develops it while young. It also has many reasons, but let's first identify them. We'll hear a little explanation. Then there's a third migraine, which is definitely an inherited migraine. But it's discovered after 30 or 40 years, and it affects the patient the same way as those present at birth. Then there's a fourth and final classification of migraine, which doesn't come from inheritance or genetics, not from parents, but only from working in the sun, causes constant high blood pressure sufferers to get it. Now, this is a migraine that doesn't come from blood or plasma, nor is their genetics part of inheritance, but only due to society, they become migraine headache patients. Now, there are two types of people in this, as I mentioned. Those who work in the sun get it, or those who think too much or have high blood pressure. Migraine affects them. But this fourth category I mentioned, where patients are affected by sun or thinking or high blood pressure, this is all considered the mildest category, and is mild because genetically they can't compare to migraine patients, and with medication they get better, or sometimes even without medication such people's migraines get better. Now we'll see what happens in